Hi friends, today I have the honor and the pleasure of having a very dear student with me, a very intelligent boy and a very dear student of mine, Dr. T. Seetam Kumar, for getting rank AIMS 19 in this May 2017 exam. I'm really proud of his achievement and I want to ask him how is he feeling right now.
Oh, it's amazing to getting into in best 20s in AIMS, and finally I got into radio diagnosis through NEET and joined in Rohtak.
So now are you happy doing radiology now?
Yeah, obviously.
So and how is the feeling to see your name in the list in the top 20 in AIMS?
It's
It's-
yeah, I can't speak. It's very much unspeakable things, and
You feeling good?
yeah, fine.
So, what comes to your mind now that like, what is it that you want to speak today, and like I'll give you like an opportunity to like thank you want to thank somebody you feel that
Yeah, I am very much thankful to my mom and dad and my bro, and to Sumer sir and Dipti ma'am and Rajiv sir and Tushar sir and every department who taught me how to which subjects, which things I have to think and go through these important topics, and where to this going through these topics.
which center did you join at DAMS?
I joined DAMS Bhubaneswar regular batch in 15-16.
And how was your experience?
It was very fine. It's located in the mid of the city, and every for food and residence also it's good.
And did you enjoy the classes?
Yeah, I definitely enjoyed classes. It was usually I was a front benches, so I usually
That
talk
is why I
with
remember you also. You
Yeah.
always on the front bench. Very good.
Yeah.
So there is a message that I want everybody to have. If you sit on the front bench, you get a good rank. But don't take it too seriously. I've even seen people from the last benches get a
Yeah.
rank. So it is like not a statistically significant thing. But it is like the teachers usually would notice the people sitting in the front. more. Yeah.
Yeah.
So and Seetam, now what was your idea about this AIMS exam? Like, what do you think are the topics that the AIMS examiner has taken, like, given more importance so that people who are listening to us today can learn something?
Since last 3-4 aims, you can go through old papers. You will see the first prof and second prof the subjects are very much important, and emergency medicine, just like how to treat emergency conditions, how to go through the different diagnosis treatments, that type of things in medicine and surgery, and obviously such subjects are very much important.
So this year what we've done is what I have observed is that images are a very important part, like
Yeah,
last year.
yeah, images are
emergencies
must
emergencies are like integral part of what DAMES wants to ask you.
Yeah.
And second is they are like also looking at things like integrated approach to questions where
Questions,
radiology
yeah.
is a part of a clinical scenario like
Yeah,
that.
they always ask the question, and there is a hidden thing inside the question, and get into the right answer after you point out the hidden thing in that question.
So what I've planned this year, that we have planned that we'll be having special sessions on emergency medicine, management of a patient in trauma emergency.
Trauma.
We've already planned that, and we do that session. I'm sure you must have attended at
Yeah.
your time. Did you attend DVT?
Yeah, obviously,
Yeah,
DVT is
so-
a must for.
Did you revise DVT again?
Yeah, obviously.
So now it must be on your tips.
Yeah.
So what DVT session that we try to be comprehensively cover all the
All the
images,
topics.
all the points that a person needs to revise in the
Revise
end.
it.
Yes. Did you give the DAM CBT?
Yeah, I given.
What was your rank in DAM CBT?
It's around 40, around.
40. So your rank at the CBT is 40, and you have been able to maintain the rank
Maintain it,
around that.
yeah.
You've been able to maintain the rank. Very good, very good. And now, so far we have learned from you like what were the topics in AIMS and how what are your advices. Now, if I ask you, if I corner you and I ask you, name one topic that a person who is going to prepare for November AIMS this time, he should read. What is your predictor? One topic.
Okay.
Give me. I'm putting you in a corner.
A psychiatry treatment therapy.
That is very important, I think.
Yeah.
I think. And plus, and if you see even the patient load of psychiatry is increased overall in the
overall.
country.
Yeah.
So it is imperative as a general physician, everybody should know a little bit about psychiatry. And same thing you will see trickling into the exams also.
also.
And the value has increased.
Yeah,
Value has
psychiatry.
increased. That is very nice. And now if I, again give you an interesting question, because, I did not tell him all the questions, so because I wanted him to answer spontaneously. That Seetam, what, I know that you've been motivating your juniors in Berhampur, and,
Yeah.
students in your college are, very fond of you.
Yeah.
So say something motivating for Odisha students.
For Odisha students, I can speak in Odia also.
Yes, you can.
तो तुम मानू डैम्स रे जॉइन हेबा मस्ट तो डैम्स रे जॉइन हेले ही व्हाट एवर द थिंग तुम जहाँ भी भावुच करबा पई ताटू फर्दर 2-3 स्टेप आगु जीव तो दैट विल द डैम्स इज मस्ट फॉर एवरीवन हु इज डूइंग यूज इन ओडिशा.
Okay, so kind of you. And I was just wondering what were you saying. And another question, Seetam, that I want you to do is, now can you give a generic motivation line, because I know you kind of motivate students, like tell them what do you want to tell them, like what is your mantra of success,
Yeah.
how you could persist, and even after getting radiology you gave the AIMS exam, you get a top 20 rank.
The word is burning desire, which pushes me whatever the thing going around me, or what else maybe the conditions, whatever the situations, the burning desire and attitude which helps me to give further and go ahead.
I'm smiling in my mind when you say burning desire, because I say, when somebody asks me, I say fire in the belly,
Yeah.
that is what you keep saying, that you have to have that fire to do something big, otherwise you'll not be able to do it.
Yes.
If you, otherwise you'll get, he's got radiology through NEET, he could have said, okay, I'm relaxing now, but he said, no, I want to continue, I want to give the AIMS exam, and because that is the apex institute in the country, and now he has a rank 19 AIMS, and I think he deserves a big hand from everybody is sitting there. And now I'll ask him, any particular teacher in DAMS that you want to thank?
Yeah, obviously Sumesh sir and Dipti ma'am, and Rajiv Shetty sir, and Tushar sir.
So these are your top favorites.
Yeah.
Okay. And anything that you want to add on, that you feel that any student or anything that you felt during your preparation time, that that if somebody can, because I feel that I'll give you a cue, that what I want to actually I want you to say to people is that when you are from a peripheral college,
Correct.
and sometimes you see that only you get that fear that will I be able to reach to the central institute. So do you want to tell people from a peripheral city, you did your MBBS from
MKCG Medical College, Berhampur, Odisha.
Berhampur, Odisha. So you want to tell people from such cities that they can do it?
Yeah.
How
obviously.
can you reassure them?
Yeah, the reassurance is, if you see something which I have to make sure to get in that institute, first is you have to dream for that, and after that you have to work hard and systematically. It can't just morning and come and this type of things. You have to work hard day by day since your undergraduates, then internship, and if you can't dream, you cannot get it. So first you have to dream of the getting into Central Institute.
So I'm cutting you here because I want to know, when did you dream about AIMS?
Yeah, it's around my third MBBS.
Did you
Part 1.
Did you go to Pulse and or why that?
Sir, I met you in Chennai,
okay,
sir.
you met me in Chennai. Okay.
Chennai.
So at that time you started.
Yeah, started.
Because I feel that it's like touching life. That is why I said it, because today when you heard me, you felt that you want to do it. Like today somebody is hearing you.
Yeah.
He might you don't even know.
No.
He might feel that okay, even I want to do this, and and because yesterday I was talking to a student who said that he listened to one interview, he got inspired. He never met the other person, but he said that he inspired. So it is like touching lives. Yeah. You never know what lives you touch, and I'm sure listening to him is very motivating for people. He is a classic example of a lot of hard work, lot of humility. He is very humble, he is very hardworking. I wish him all the best from the entire DAMS family. We are very proud of his achievement. He's a proud Damsonian from Bhubaneswar, and that is a very, very, very close city to our hearts. We love teaching there. Students are very intelligent, very hardworking, and I'm sure seeing his result, juniors from his college would also feel motivated.
Yeah.
And I'm sure he will get many juniors in AIMS and in radiology from his college. You want to say some final words?
Yeah, come to AIMS.
So he's finally inviting everybody to come to AIMS. Put your hard work, reach AIMS. Thank you very much.
Thank you.
This is me signing off. I wish you all the best for your exams.